Hello, Facebook. Hello, YouTube. This is Science Policy Office Hours. I am Dan English. I am the program coordinator for the Missouri Local Science Engagement Network. That is a part of the Most Policy Initiative, and we are here to increase the discussion around science and policy topics. Today, we're going to be talking with Dr. Josh Mueller about health and mental health topics coming up in the Missouri legislature. But before we do that, I hope everyone's staying warm. This seems like the first warmer day here in Missouri in a while, and maybe throughout much more of the Midwest. Who knows? Maybe some snow will begin melting. I just wanted to invite everyone next Friday, same channel, same place, to our climate change roundtable discussion. We're going to be talking to some of the leading researchers here in Missouri about climate change and its effects, and the opportunities, quite frankly, that Missouri can be a part of. But before we get to that, let's bring Dr. Josh Mueller in. Josh, how are you doing today?
I'm great. How are you, Dan? Staying warm?
Yeah, staying warm here. Staying warm.
Trying to.
Yeah, you're in Jefferson City. You're in Columbia right now, and
Columbia.
you're working on health and mental health topics. What do you have in store for us today?
Yeah, so I'm going to give a rundown of first I'll touch on just the sort of broad topic areas that we've seen discussed in the legislature thus far, and then maybe dive in a little bit more to specific bills that have had some action on them, open things up to questions, hear what's on people's minds. So let me give kind of a broad overview here so that anyone watching, if they have any questions about particulars, maybe they can brainstorm and throw something in the chat. But broadly, the topics that we've seen come to the table so far include COVID and sort of related ripple effects. No surprise there. Infectious disease more generally, not just related to COVID. I think maybe having a pandemic Royal Society does get us thinking about all sorts of other things that we should be prepared for. Prescription drugs, Medicaid expansion, professional licensure as it relates to medical professionals, healthcare providers, all sorts of things related to insurance, and then kind of a grab bag of other things that are interesting and are getting some airtime, whether that's regulations around tobacco or medical marijuana, or awareness and action plans for students with seizures in schools, occupational hazards for firefighters and first responders. So really a lot happening in the Missouri legislature. It's always great to hear from the other fellows on other topics, because I know that this topic is so diverse, the health and mental health landscape, and to know that not only are legislators juggling all this, but they're talking about energy and environment and agriculture and education. There's really a ton on the docket.
Yeah.
So I guess
before I hand it over to you, Josh, I just want to remind everyone, hey, go to the chat down below, whether you're on YouTube or whether you're on Facebook, and type in your questions there. There's maybe a 15-second delay in between when we're talking and when we're able to answer questions. So just be patient. We'll get to them. And Josh, are you ready to take it away?
Yeah, so I guess I'll dive in a little bit more finer grain on some of these topics. So kind of in terms of priority and movement, things that we've seen move through the legislature here are what I'm kind of calling COVID-19 ripple effect pieces of legislation. So not necessarily related to trying to stop the spread of COVID per se, or deal with the spread of the disease itself, but kind of thinking about the tangential sort of knock-on effects, things that have happened as a result of the pandemic. So what I'm talking about specifically here, the two bills that we've seen take up a lot of committee and floor time and get a lot of interest right now related to COVID are Senate Bill 51, which addresses COVID liability, and then Senate Bill 12, and both of these have rolled up a lot of bills into them. So there's a lot of discussion about this, but Senate Bill 12 basically relating to public health emergency powers. So COVID liability is something that was on the docket for the special session in the fall and kind of dragged out into regular session here. So what has ended up happening is a few different proposals have come together to basically grant small businesses and healthcare providers and manufacturers some business protections from claims of kind of neglectful spread of COVID related to either conditions at their place of business or at their healthcare facility, or due to maybe faulty manufacture. So right now, what the actual text of this COVID liability protection bill has put forth is basically raising the standard of what sort of event it would take to be able to successfully pursue a lawsuit against one of these entities to the standard of basically recklessness or willful misconduct that then causes an actual exposure to COVID-19 that then leads to actual personal injury. So I think basically the gist here is that they've put a fairly high bar for people potentially seeking redress for perceived or actual injury related to COVID-19 spread. And then the second bill that kind of has had a few bills wrapped up into it and a lot of debate around it relates to public health emergency powers. So I think there's been plenty of discussion in the news about things like school closures, business closures, church closures. And so the legislature has come together to try to figure out what sort of restrictions on public health authorities would make sense going forward. And so what this bill would do, and it is on the Senate floor, so it's made out of committee and still being kind of tweaked and modified. But as it currently stands, what it would do, should it pass both chambers to be signed, is basically restrict the duration of public health orders enacted by local health entities. So if, say, your county commission or city council were to put out a health order that restricts, say, the number of attendees that can enter a business or something like that, this bill would put a restriction on the number of days that restriction can be in effect before subjecting it to legislative oversight. So it would have to be renewed. It would have to be voted upon by sort of elected officials who would be able to rule on whether they want to extend that or not. There's all sorts of other provisions tucked into here, basically with the broad intent of, I think, kind of in reaction to what we've seen from local health authorities doing, kind of as a reaction to that, trying to change who has the authority to put what sorts of health restrictions on the public. So this includes basically taking the local health authorities' power away from them to be able to restrict the number of people you can have gathering in your household, people that are allowed to gather in religious institutions, things like that, not having to quarantine from members of your own household. So there's a lot of provisions tucked in there, but generally what it's doing is trying to modify the ability of local health authorities to enact restrictions during public health emergencies. Another sort of COVID ripple effect bill that we've seen move through relates to telehealth. So one popular option for people who are not comfortable or not able to go receive healthcare in person right now is to use telemedicine resources. And so a few waivers have been granted to basically allow people temporarily during the state of emergency to access telehealth resources with kind of lower regulatory barriers, whether that means accessing a healthcare provider out of state or being able to access a certain type of care. So what this bill would do is basically codify into law that you would be allowed to use telehealth, a telehealth meeting visit to establish a doctor-patient relationship with a physician that maybe you haven't seen in person. So beyond that, I mentioned that there are all sorts of bills related to non-COVID infectious disease on the docket. So what I'm thinking of particularly here is a few bills related to kind of HIV, hepatitis, things like that. So there's a bill in the Senate right now relating to needle exchange programs that would legalize these programs to basically allow people who use needles, primarily for injection drug use, to exchange their used contaminated needles that potentially are an infectious disease risk, to exchange those for clean syringes at a healthcare provider. So this is meant to kind of mitigate the spread of infectious diseases like HIV, hepatitis. Related to that, there have been a few bills that are aiming to sort of modify the penalties around communicable disease spread. Right now, they're fairly strict laws penalizing folks for knowingly exposing other people to communicable diseases. So this would kind of modify and lessen some of the penalties around that. And then finally, there's a bill right now on both the House and Senate side that would allow pharmacists to dispense HIV prophylactic medicine, which is a medicine that can help people who are not infected with HIV avoid becoming infected should they be exposed. Moving down the line, I think one thing that was definitely on the radar of people following the legislature, following state government this year, is Medicaid expansion. So to remind people watching, Medicaid expansion was a ballot initiative over the summer last fall that passed that would basically expand the eligibility criteria for low-income Missourians to receive coverage through Missouri Health Net, which is the state's Medicaid program. And so there was a lot of discussion about how expanding the pool of Medicaid enrollees would affect sort of budget considerations. And we now know that it looks like about 275,000, 300,000 Missourians are going to be eligible to join Medicaid, to get Medicaid health insurance coverage under expansion. So it's not a negligible amount of people. So obviously then there are concerns about how to fund this program. And so what has ended up happening Dan, I think you even wrote about this, and if people were watching the State of the State address, what ended up happening is sort of through circumstance, the federal government ended up providing quite a bit of aid through kind of CARES Act and other programs like that, and even increased the amount of federal matching funds that they provide to states for their Medicaid budgets, that basically made the program sort of solvent and able to be funded in this upcoming year. Governor Parsons spoke about this kind of in the marquee portion of his speech, saying that they're going to be able to successfully expand Medicaid here. So there's been a lot of discussion about this, but not yet a ton of movement on legislation. I would expect that this is sort of the next wave of things that we'll see, is now that the budget has been submitted and approved, what sort of tweaks can be made to sort of make sure that that level of coverage is feasible going forward. So there are a few things that are going to be discussed. Work and community engagement requirements is one sort of angle to this, just modifying the reimbursement rates for certain types of services. Those sorts of things are on the table, but haven't really moved quickly yet. So it'll be something to keep an eye on. Yeah.
Oh, yeah. Sorry, I thought you were done. Keep going.
Yeah, no, I'll kind of tick through a few more things here. So prescription drugs is something that I think is always an important topic. People are always aware of the sort of prices that they pay for prescription drugs, whatever their needs may be. So there's a few bills that would increase basically transparency around pricing, especially on things like EpiPens and insulin. There's legislation that would basically remove restrictions on access to antipsychotic medications. So I think the idea here is transparency, price control, and access on prescription drugs. Few last things. Professional licensure. I think COVID has also brought to light that there are pre-existing shortages in healthcare providers and services all across the state of Missouri. And so one way to address this is to kind of expand the pool of potential caregivers and make sure that people are able to get care where they need it. So there have been bills related to expanding scope of practice for advanced practice registered nurses. There are bills related to basically allowing doctors and occupational therapists to get licensed in Missouri based on a license they have in another state. So that would kind of like ease the burden of moving and being able to practice in Missouri. And then, yeah, I think just general health insurance, there are a few things that are out there. Mental health parity is one. So there's a bill moving through the Senate right now that would require health plans to basically be as generous in their provisions for providing mental health related care as they are for other types of care. There's a bill in the Senate from Senator Brian Williams dealing with surprise out-of-network billing to kind of prevent people from paying prices that they weren't expecting. There's a bill that had a hearing in the Senate about expanding private health insurance to make sure it's covering hearing aids. So really a lot to be done. I think the COVID and COVID ripple effect sort of legislation has sucked up a lot of the oxygen for now. So we'll see, of the things that I mentioned here towards the end, which of those actually gain traction and move through. But as hopefully you can tell, yeah, there's a diverse portfolio, a lot of exciting things on the docket. So maybe I'll turn it over to you if you have any questions, and then we can open it up if the audience has anything they're curious about.
Yeah, certainly a lot to talk about. A lot of interesting questions come to my mind. But first, I want to remind everybody about our climate change roundtable coming up next week. Same bat time, same bat channel. If you want to learn more about that, head to MissouriLSEN.quorum.us. Actually, that is scrolling down at the bottom of the screen right now. So head to that website, scroll down a little bit to where it says events, and you can sign up and learn more about that there. We'll have an after party afterwards. So who knows what'll happen? Maybe you'll meet some new Missouri researchers. Back to Dr. Mueller here and his topics. I'm thinking about COVID-19, and the governor said, more vaccination sites, some mass vaccination. I can't say that word right now. Vaccination sites are coming up. Is there any updates on the vaccination effort here in Missouri?
Yeah, so I think that there was a focus on Missouri as it relates to vaccination, because I think as of maybe a week or two ago, there was concern that Missouri was kind of falling behind, that we were in kind of the lower rankings in terms of getting vaccinations out there. So in response to that, a few things were proposed, including setting up these mass vaccination events to try to really get people through. Another thing that came up was trying to maybe reclaim some of the doses that had been given to pharmacy companies like CVS and Walgreens that they were sitting on, to try to make sure that those are getting into arms, getting deployed. The one unfortunate thing I'll note is that right as this is all happening, of course, we had this winter storm, and so there's been seemingly a little bit of a delay and setback in holding some of those mass vaccination events, and then also potentially just in people's actual ability and willingness to go out and get vaccinated. But then also there's potentially some reporting lag. So it's tough to tell because we're still right in the middle of it right now. So it looks like there's a slight dip due to the weather in terms of the rates of vaccination. But I will say that after sort of that attention was placed and after the governor's speech, it looks like the number of vaccines being put in arms sort of has ramped up, and there has been some transparency, particularly I'm thinking from Dr. Williams, about what the state's plan is to make sure that enough doses are getting out and that those doses are being distributed equitably. So I think, I think the state is definitely being responsive to the concerns that they're hearing, and I would expect that once we're on the other side of the bad weather, that people will be seeing more about mass vaccination events. Just as a reminder, we are in this phase 1B tier 2 right now. So something like 3 million Missourians, I think, are currently eligible to be vaccinated. That's an excess of demand. There are not 3 million first doses available in Missouri, so there's some triaging happening there, and the capacity is not there to put that many doses in arms immediately, frankly. So I think, the question going forward will be if we can keep up the rate and make sure they're getting enough doses from federal partners, and try to get things slightly back to normal as soon as possible.
All right. I see some people are giving us some thumbs up. So remember to whack that like button. If you're on YouTube, give us the thumbs up. We really appreciate it. And I just want to remind everybody, we have, if you have more questions about the COVID-19 vaccine, we have videos up on our YouTube and our Facebook streams about the COVID-19 vaccination and vaccine equity here in Missouri, and about how to get the vaccine to the most vulnerable populations. I want to urge everybody to get vaccinated. I got my second one today, so yay for me, leveling up there. Josh, back to you. More questions about COVID, COVID-19, and I'm interested in the legislation protecting businesses from litigation. Are there any carve outs for individuals who may have experienced an employer who through negligence caused them to get sick?
Yeah, so I think that there was a lot of discussion about this, about trying to avoid the unintended consequences of if you put these liability protections in place, is that going to give people permission to be kind of negligent? And so I think the sort of consensus that I heard discussed in committee hearings was that the language is still tight enough so that is there sort of knowing misconduct and recklessness. So I think this is a little bit higher than just ordinary neglect. But if there's kind of a real disregard over and above the normal standards of what might be kind of reasonably expected, that there's still recourse for employees. The other thing that got raised along these lines, Dan, is what about fraud? What about if people are manufacturing masks, for example, that they say are N95s that aren't? There's still carve outs so that should there be this kind of willful bad behavior, that people can seek redress for those sorts of things.
That's something that has been in the news the past couple of days, are actually hospitals getting fake N95 masks. And that's a real concern for healthcare providers across the state. Let's switch gears now to Does anybody have any questions here on YouTube? We've been talking about COVID-19 so much. I forgot what other topics we discussed. So
There's
if you
so much
have
else
any,
going on, Dan. Yeah.
there is, yeah, there's a lot going on in health and mental health policy here in Missouri. Let's switch gears now to telehealth. I know that's going to be huge in the future, and a
Mhm.
lot that has to do with telehealth also has to do with broadband in Missouri.
Mhm.
Can you tell me a little bit about the efforts to get broadband to anybody? Is that something that you're familiar with?
Yeah, so I think I would direct people definitely to the work that one of our other fellows, Dr. Jenny Brapper, has done about this. She's looking at a lot of sort of infrastructure related issues. But yeah, it definitely is a sort of sequencing problem here. You aren't going to have access to telehealth, telemedicine resources if you don't have reliable internet. I think a lot of people are thinking about this as well in the education space. You know, if you're trying to have classes over Zoom, for example, and you don't have reliable internet at high enough speed, then that kind of cuts you off from access to those sorts of things. So there are state initiatives and federal initiatives putting money out there to try to deliver all sorts of like last mile coverage where maybe the skeleton of broadband delivery is out there, but then trying to branch off transmission routes to get those to underserved, kind of sparsely populated areas. But I think, yeah, there's legislation that Dr. Jenny Bradford is covering that I would definitely point people to. Shameless plug to go check out our site, check out our
Yeah,
science
absolutely.
notes.
Go check out mostpolicyinitiative.org. Click around there. You'll be able to find all kinds of science notes related to different policy topics that are relevant here in Missouri. We are getting one question from Dr. Eleni Bickel. She says, a layperson's question here. We know that COVID vaccines need to be stored and refrigerated when transported. How can the low temperatures also impact the effectiveness on the vaccines?
Yeah. So there's a few different parts to this question. So I think right now the standards are such that, that there are kind of strict standards so that if a dose of vaccine ends up at a temperature that is above what the sort of safe handling protocol suggests, that those are supposed to be discarded if they sit at that temperature for too long. So definitely if there's not proper cold chain storage for these mRNA vaccines, well, really not all of them, but certain vaccines, not all of them. So that's the part two. If the vaccines that require super cold, ultra cold storage are mishandled, then yes, that definitely will affect their efficacy. The kind of caveat to that is that now we're having more vaccines come online. Recently, the Johnson vaccine, I think promisingly is a one-dose regimen and does not need the ultra cold storage. So I think from what I can tell, the cold chain part of the problem has been handled fairly well as you could handle on kind of a short timetable like this, and hopefully some relief is on the way so that some more kind of manageable, less finicky vaccines are going to be available to make sure that healthcare providers are able to breathe a little bit easier and not have to worry about doses going unused because they expire due to handling concerns.
Yeah, I'm glad you brought up the Johnson vaccine. It doesn't require as much of a cold chain. It is just a bit less effective than the Pfizer and Moderna vaccines. But what we know about the Pfizer and Moderna vaccines is they need something called like a -80 freezer. And that's something that, may be fairly common at research institutions like Mizzou and hospitals, like Washington University and SLU in St. Louis and here in Kansas City. At all the different research institutions around here. But sometimes in the middle of the state, if you go to, Warrensburg, that might not be a thing there. There might be, freezers that get that cold might be hard to come by. So that makes it a little difficult to get those vaccines to people who need them in those places. We're getting another question here from Dr. Jill Barnes. Thanks for the update, she says. Josh, speaking of businesses, have there been any conversations related to COVID-19 and fitness centers and gyms? That's a great question, Dr. Barnes.
Yeah, there was an interesting hearing last week. Representative Jason Chipman brought legislation forward that would should it be passed, it would classify gyms as the same kind of tier of healthcare provider as hospitals under the sort of logic that People are going to gyms often to either receive therapy, physical therapy, or as kind of a preventative measure to just improve their overall health and well-being, including mental health. So right now, that carve out for gyms does not exist. They're being regulated under sort of regular business standards. But it is worth noting, yeah, it was kind of interesting hearing back and forth a little bit of lively debate about to what degree we should be thinking about places that aren't explicitly hospitals. We should be thinking about those as places where important healthcare services are being provided.
Mm-hmm. That's interesting about gyms, because obviously people go there as places for well-being and healthiness, and some of the gyms, especially if they're crowded, can be super spreader events. So it's a difficult question for sure to answer. I just want to give another shameless plug. If you're just tuning in, whack that like button, give us the thumbs up on YouTube, improve our analytics, and also if you're interested in discussions like this, we've got a big roundtable discussion on climate change happening next week. You're probably getting sick of hearing me say it, but head to MissouriLSEN.quorum.us, scroll down a little bit to our events section, and you can sign up to get more information there. Josh, I think we're running out of time. So is there anything else you want to add?
I think we covered quite a bit, Dan. I would say on the really sort of nerdy nuts and bolts level, the House Health and Mental Health Committee really expressed a uniform, universal, resounding interest in thinking about going forward how to increase the availability and access to mental health resources in particular. So it's not something that I was able to really cover today in terms of active legislation, but I think for people thinking about this area, it's something that the legislators have been hearing from their constituents and are responsive to and are really thinking about going forward. So I think that's an encouraging development, and we'll keep an eye on it as it develops.
All right, sounds good. Hey, and if you have any science engagement related questions, any science engagement related topics you'd like to see discussed, send us a message, or engage with us through Facebook, through Twitter, through YouTube. Anyway, I'm Dan. That's Josh. We'll see you next time. All right, take care.